Hi, this is Dr. Paul Goldberg at the Goldberg Clinic. I am very happy today. I have a very old friend of mine, very old patient of mine, who's not really very old, but we've known each other for a long time. When did we meet, Rebecca?
I was 51 the first time we met.
And how old are you now?
68.
And she says that proudly.
Oh yes, absolutely.
Yeah, 68. We met when you were 51, so that's 17 years we've known each other. And Rebecca first came to see me when I was still in my old office. And what did you come to see me about back then?
I was passing out, and nobody could determine why I was passing out. Exactly.
And you did get well, didn't you?
I did. Within a few months, I was as healthy as I had ever been, and have never passed out since.
And so that was 17 years ago. And so Rebecca has kept in touch with us over the years. We come in once in a while and see us every, I don't know, once a year, once every couple of years. And then, what year did the other issue start out?
About 2012, I believe.
In 2012, I remember Rebecca came in, and she did not look like Rebecca. What was going on with you at that time?
Well, I'd had several issues in my life. I had retired from teaching. Both of my parents had passed away within a year of each other. My husband had had major surgery where he could have been a quadriplegic if things had not worked out.
And so what had you developed as a result of this, partially at least as a result of the stress?
Well, I had noticed a lot of pain in my joints and muscle pain, and I had come in to see Dr. Goldberg in the latter part of 12, and he said, "You're just not yourself."
You went to a medical doctor at that point?
Yes.
And what did the medical doctor diagnose you with?
Well, he took his time diagnosing me. He thought he put me on muscle relaxers first, and well, he wanted to put me on prednisone. And he said, because a short duration prednisone, and he said, if this helps you with your pain, because I was in severe pain at the time, he said, then I'm going to send you to a rheumatologist. And I said, at that stage, I'd been working with you several months, and the SED rate, which was the only medical marker that was out of whack when I had my blood work and all of that done, and my SED rate was starting to show some improvement. And because I had such faith in Dr. Goldberg from my earlier experience with him, I told my doctor, I said, I want to hold off on that. I said, if my SED rate is coming down, then I know that there's going to be room for improvement.
At your worst, what were your symptoms at that time? I mean, you had symptoms of rheumatoid arthritis. What were your symptoms like?
I was in severe muscle pain and severe joint pain in my hips, my knees, and in my shoulders.
You used to hobble into the office.
Yes.
You were not your normal sprightly self.
No.
Running in and out of the office with a smile on your face.
Absolutely.
And it's pretty hard for Rebecca not to smile because she's a smiley type person.
Oh, thank you.
And so she came in, you were in a lot of pain.
Yes.
And you tried to hide some of it. It was pretty obvious because you were having trouble moving.
Yes, and I didn't want to take anything for pain.
And your husband, John, who's a great guy, and he was concerned about you. He wanted you to try taking those steroids the medical doctor was suggesting.
Yes, he wanted me to try that to see, if that could be helpful.
Well, the interesting thing about it is, though, that no matter what kind of inflammation you have, for what reason, steroids will mask it. Mm-hmm. So if you had taken it, if to say it would help you, it would have helped you.
Yes.
But what would have been the side effects of the steroids?
Yes, and I do have osteopenia, so I knew that steroids, any type of steroids, could affect my bone density. And the illness itself affected my bone density. So I had seen my father on steroids in his later life.
Yes, and some of the complications are diabetes, thinning of the skin, mental repercussions, depression, osteoporosis, lowered immunity to infection. The list is quite long. So, kind of long story short, Rebecca, so you climbed on board the Goldberg train again and worked with me. And what was the outcome of that?
Well, it took longer this time for me to get things straightened out, but by June and July of 2013, I was seeing improvement. My SED rate was improving, and I knew that I was on the right track. By Christmas, I was back to my normal self, and I was ready to start an exercise program. And at that point, I started yoga. During my illness, though, I was a great believer in meditation, which helped me to deal with issues that the stress had affected me with.
So that was back in 2012, and now we're
And
into
13.
yeah. So now we're into 2018. You were headed towards rheumatoid arthritis. The medical doctor wanted to put you on steroids. We're 6 years out almost now. How's your life now?
It's great.
You're almost how old?
Almost 69.
Almost 69.
And I do
And what'd you just tell me? You can now do what? Headstands. And what else? Handstands.
In yoga. I have a great yoga teacher who brought me through slowly from my most difficult days in the beginning when I started.
Oh, come on, you're being too modest.
Well,
what else can you do?
I can almost do a back bend.
You can do a back bend. And in addition to that, what do you do on a regular basis with your lady friends?
Well, we do yoga and we hike, and
what kind of hikes do you go on?
Well, I have a group of friends out west who invited me to
How many
hike.
miles?
Well, anywhere. The longest ones can be 9 to 10 miles.
So this is a lady who in 2012 was hobbling in my office with joints that were inflamed, sed rates were rising. A medical doctor wanted to put her on prednisone, and we just did a physical exam on her today. She's about as close to perfect as it comes.
Thank you.
Yeah. Wouldn't you say? And the real lesson here is not to fall prey to just opening bottles of drugs and taking things just to suppress the symptoms, because Rebecca is an introspective person, and with me together, she discovered what was leading to this problem, and then we found solutions for her getting out of it. Unfortunately, did it before it got well entrenched.
Well, and I think earlier you had taught me that the body is an amazing instrument, that it has so much ability to heal itself if given the right.
Exactly. It is given the right conditions.
Right.
That's the thing. You have to give it the right conditions. And clearly, the stress you're under and taking steroids were not going to be the right conditions. Right.
No.
All right. So this is my good friend Rebecca Curtis, who now, at almost 69 years of age, is in vibrant health, and I'm really proud of her, and I'm even proud of Dr. Tenner and myself.
Absolutely.
Because she's done absolutely great. Thank you, Rebecca.
Oh, thank you, Dr. Goldberg.